All right, so now you want to talk about heel pain. Well, I wish I had a great answer as to why people get heel pain. For everybody, it's different. It could be that they had a big vacation, they went to Vegas, they went to Disneyland, they walked a lot, they got heel pain. It could be new shoes, it could be their job, walking on uneven surfaces, it could be they started a new exercise regimen, it could be they haven't done anything for a long time, and when they get up, they get heel pain. There's a ton of things, but I think that if you were to really break down the basic reason people get heel pain or arch pain, would have to do with instability. And when you have instability in your foot, your tendons have to operate in a different way. Your ligaments have to operate in a different way to stabilize your foot. So if one part of your foot is going kind of out of whack, the other part of your foot tries to make up for it to stabilize everything, and that can lead to pain. And so if you think about, like if you were to go to a restaurant, it's kind of the easiest way to visualize this. Everybody's been to a restaurant, they sit down at the table and the table's wobbly. Like, oh man, I had to get the one table in the restaurant where the table's wobbly, and it's just annoying. And you're like, I can't eat like this. The table's just kind of crazy. Well, what's the first thing you look for? Sugar packets. Everybody looks for sugar packets because we're going to stuff the sugar packet underneath the leg of the table to stabilize it and get everything kind of on an even keel. And one thing to think about with heel pain is if we can, and arch pain too, if we can stabilize the foot, that may at least ease, if not take away, that pain. And so one way we can do that is to make custom orthotics for your foot, or inserts that are custom for you that go in the shoes, that basically they act like the sugar packets. You're walking in an unstable way, and we're going to restabilize your foot so that, hey, I'm not unstable anymore. And really, in our office, we use 3D scanning, and we use a computerized plate that you walk across to get kind of an idea of how you're walking, as well as a visual exam. And we want to make sure that you don't have any limb length discrepancy, or maybe one foot is really out of whack compared to the other, and what we can do to put everything back into place. But typically, if you want to break down heel and arch pain, most of the time it just comes down to instability. Now, that's different for kids. With kids, a lot of times when they have heel pain, it's in a bit of a different location, and it has to do more with the growth plate in the heel, and the growth plate can get irritated and get inflamed, and that can cause pain. It's really common in active kids that are between the ages of 9 to 11 years old, typically is what I see in my office. Again, stability would be helpful for that, anti-inflammatories, icing, but getting them into an insert or a heel cup to kind of either give some shock absorption or stabilize the foot makes a really big difference for kids. And if you want to look it up, it's something called Sever's disease, and it's not really a disease, but I believe Dr. Sever was the one who discovered it, and so he named it after himself, and that's great. But when you can find the one disease that you can put your name on, I think every doctor does it. But when I was a kid, I had it. It's very common, but really easy to treat. And you think of why that area is so susceptible to getting that pain, especially in active kids. It really comes down to the Achilles tendon and where it attaches to the heel. And there's a growth plate right there. So you think of your heel like this, and then there's a growth plate here, and then the little bone here. That growth plate kind of runs in the middle there, and the Achilles tendon attaches in this area. And every time you move, that Achilles tendon pulls on that area and causes irritation. So for kids that are active and they're running and they're jumping, you're talking a lot of force on that area, and that leads to inflammation. That inflammation leads to pain, and certainly for a lot of kids, they want to stop their activity, not because they don't like doing what they're doing. They're usually pretty frustrated because their run from when they hit the ball to first base is starting to kill them, and they're not able to perform as well. They don't know why they have this pain, and usually they don't even tell their parents. Their parents kind of see them limping and go, what the heck's going on? And finally it comes out. But the good news is it's very, very treatable, but it's a different type of pain. It's a different type of problem than what adults have. Adults have an instability issue. Typically, kids have this growth plate issue. Both heel pain, but very different types of pain. Treatments can be similar, but certainly if you feel the sharp pain first step in the morning, if you're an adult, kind of goes away after you walk for a while, and maybe comes back later on in the day, probably plantar fasciitis. If you're a kid that's active and you're having pain when you run or jump, probably Sever's disease. So come on in, see your podiatrist. It's stuff we treat every day, and we can get that taken care of.